Thank you, Angela, for that wonderful introduction. It's a real honor for me to be here. Now, if you miss a doctor's appointment, your doctor doesn't come knocking on your door reminding you that you're overdue. Yet in developing countries, that's exactly what happens. Each year around the world, 4 million children die before their 5th birthday, and 1 out of 5 of those dies because they don't receive their vaccinations on time. Now, luckily, thanks to increased globalization and technology, children are being immunized at the highest rates in history. Yet global health organizations are trying to reach what's called the last 20%. And that's the 20% of children that they live in very rural or hard to reach areas. They're born to parents who are less educated than those in urban areas, and they are still immunized weeks or even months late. Now, I witnessed this dynamic firsthand during a summer internship after my sophomore year here at Cornell University. And what I saw was, here I am working here at this clinic, and what I saw was moms, these indigenous moms would come in for their child's vaccination appointment, and they would be handed a tiny piece of paper, like a Post-it note, to remind them of the date that they were supposed to come back the next time. But as you can see, these mothers, they're indigenous, they're very poor, they tend to live on about $1.25 or less a day. They're not very well educated. They go to school for about a couple years, and they understand that vaccines are important for their children's health, but they don't understand how a vaccine works or why it's important for them to come back on time for those vaccines. So what happens is mothers end up losing that piece of paper, and then they don't come back on time. Now, my job this summer was to follow these nurses into these villages and actually look for moms to remind them that they were overdue. But as you can see here, these houses in the streets were not well marked. It took often up to 4 hours a day to even find these moms. And we had to often ask neighbors where moms lived. And then when we got there, the moms wouldn't be home. So we had to come back multiple times. And a second problem I found that beyond just these moms not coming back on time was that it was really increased clinic inefficiency. Because what happens is when you're in a poor area like this, you've got really crowded clinics. You've got patients that come there at the crack of dawn to see a nurse. They wait the whole day to see a nurse, hoping that they can have their child or themselves taken care of. But what happens is, because they need to account for all these patients, the nurses have to take precious time out of their day and go out and look for these moms. So it's a very inefficient system. These nurses they're not really paid very much, so you can see how dedicated they are to making sure that every patient is accounted for. A third problem I found in my research is that the Peruvian government actually pays for 100% of all childhood vaccines. The problem is that the more rural, the more remote, the more difficult to reach a clinic is, the less likely those moms are to come back on time for appointments because they're less educated. So what you have happening here is you have the Peruvian government essentially paying twice because vaccines aren't used on time, they expire, they have to be thrown out, and then they have to be replaced. So it's a very costly system. You can see how this is a vicious cycle here. So the 3 key problems I saw with Peru's vaccine delivery system were, 1, you've got moms not remembering the children's vaccination dates and putting their children at risk of getting those diseases. 2, you have nurses who have to take precious time out of their day when you've got these overcrowded clinics to look for these moms. And the third thing is you've got the Peruvian government whose heart is in the right place. They're already paying for all these vaccines, but they have to essentially do that twice. So it's a very inefficient system. And I thought there's got to be an easier way to make this whole system work better. And I thought, what if there was just like a simple device that maybe the mom could just keep on her person, she could have it with her all the time, that was in a way that she could understand. And that's when I came up with this idea of using a bracelet. Now these bracelets they cost 10 cents each to make. They're made of silicone. And as you can see, there's no words on these bracelets. So these moms, they're illiterate, they tend to not read and write. At the time I was there, they predominantly spoke Quechua, which is an indigenous language. They didn't even speak Spanish. And so what I thought was, well, let's have different symbols. You can see, I don't know, some of you, it might be hard to see in the back. There's a triangle, a star shape, a circle, a square, and each shape represents a different vaccine that the child needs. The number represents, ideally, the child's age, but it's the number of months after the child has been born that they need those vaccines. So you can see this way a mom can easily track what her child's vaccination record is. And you can see how this would work in a real setting. So you've got the mom who comes in for the child's vaccination appointment. the nurse comes over, gives the baby all the shots, and then she takes the bracelet off and she's going to hole punch out with a tiny hole puncher all the shapes that correspond to the vaccines that she just gave that baby. So now the mom can understand the number of vaccines her child needs, the type of vaccines her child needs, and also the date of every upcoming appointment and past appointment that her child needs those vaccines. So I thought, okay, great. I've got this great idea. I've got this bracelet. Now, how do I actually tell if it's going to help moms and nurses do their job better? Now, the answer to this question is very simple, but unfortunately, it's a problem that a lot of people skip. And the answer is, you just ask them. So, I put together this is my original prototype back in 2009. I put this together, and I showed it to the moms and nurses, and I said, do you think this will actually help you? Their answer to this question is the reason that I spent the next 3 years working to bring these bracelets back to them. They said, this is incredible. This is going to make our job so much easier. It's going to save babies' lives. When can we start using it? Promise us you'll bring it back to us. Now, I was only 20 at the time, so I was like, I'll do my best. I was still in college, but the rest of that week, the nurses kept coming back to me and saying, Lauren, we thought about your idea. Can you add this? Can you make it do this? And so based on their feedback, we have blue bracelets for boys and pink for girls. We have certain symbols representing certain vaccines. And based on the mom's feedback, the mom said, we don't want to wear the bracelets because we're the ones out there, they're indigenous, they do a lot of the weaving and the hand carving of little wooden figurines that they sell. And they said, we don't want to have to wear a bracelet, have the baby wear it. So that's why the baby wears the bracelet. Now I saw firsthand how successful this was to incorporate all their feedback, because when I went back this past summer to implement the project, I was able to bring this bracelet to the nurses and say, this came from your feedback. This came directly from the challenges that you told me you were facing, and it came from the input from this environment. And their support was tremendous. Throughout the first couple weeks of our study, the nurses, without us asking them, every day went out to the waiting rooms and they said, this organization is doing this pilot study. These bracelets can really help save your babies' lives. We encourage you all to participate. And we had no trouble enrolling our target number of moms, and that is the power of instilling local ownership. So that was how I came up with the idea of using a bracelet, but an idea isn't innovative unless it's scalable and sustainable. So I got back to campus that fall, and I said, okay, well, I'm essentially a public health major. I don't know anything about business. I don't know anything about product design, and I'm personally very afraid of getting vaccines myself, so it's kind of an awkward situation. But I knew that in order to make this project happen, I was going to have to learn about business, I was going to have to learn about product design, and of course, I was going to have to get over my fear of getting vaccines if I was going to be promoting this. Another thing that it took was perseverance to take this project from concept to reality, in addition to the practical skills. But I knew that I had the perseverance because for the first time in my life, I felt very deeply connected to something that was greater than myself. These moms and nurses had told me that they really, truly believed this could help them, and so that was inspiring enough for me to continue working and working and working to try to bring this project back to them. So I got back to campus, and I spent essentially the next 2 years taking business courses, including Anke Wessel's course on social entrepreneurs. I also participated in a number of different international and national business competitions, which I won top awards in. And the third thing I did was I reached out to experts who were working in graphic design, they were working in the NGO space, they were working in pharmaceutical companies, they were doctors and nurses, and most of them didn't respond, but the ones who did gave me valuable feedback, and together the courses, the competitions, and these conversations collectively challenged me to think beyond just the bracelet itself and think about how would this actually be implemented in the field. There were so many questions like, how am I actually going to get these bracelets to the babies? Who's going to pay for them? Who's going to make them? What are they going to be made out of? How do you even go about setting this up? And it was funny because at the beginning of this whole process, a lot of people asked me, what kind of technology does your bracelet use? And I said, silicone. Because the simpler the technology, the greater the chances of it succeeding in a resource-poor environment. You don't want to overcomplicate this. So, another question that I actually got a lot was, why are you choosing to do this project in Cusco when vaccination timeliness is so much worse in Africa? And I said, well, I chose Cusco because I knew Cusco. I knew the people, the language, the customs, the healthcare system, and most importantly, the idea had come from the input from this environment. So if I'm going to start a project, I'm going to start it in the place where I have the greatest chance of success. And then if it works, I can take that and put it in new places and then expand from there. And this was an important lesson for me. Take something simple and small and specific and then start there. Don't try and take an abstract problem and try and localize it. I think that's much more challenging. It was also at this time that I began the long, expensive patent process where I was working to get this bracelet idea patented for its design and utility, which just validated for me how innovative this idea was. And so by the end of my senior year, I had spent 2 years doing all this, developing all these business skills, and what I was really hoping for was that an existing NGO or an existing pharmaceutical company would take this project and then implement it. Because I was a student, I didn't have all the resources it took to do this. But what I learned is that no matter how much potential an idea has, no matter how simple it is, no matter how much potential that idea has to impact a community or how cost effective it is, it's still too risky for even a large established organization to take on. So I knew at that point that I was going to have to go out on my own to prove that this idea had this potential and it was worth investing in. So that was how I came up with I learned all the hard business skills that I needed and all the design in order to make this project happen. I had a business plan. I felt I was ready to go. Yet, at this point, the only thing standing between me and implementing the project was funding. So like most college seniors, I spent the whole year applying to different jobs, and by the end of my senior year, without any way to move the project forward, I accepted a job at a Fortune 100 health insurance company, and I moved to Kentucky. Although I was really enjoying my new work and my team, the bracelet idea really stuck with me. Now, I had signed up to receive a number of emails from global health and development organizations, and one day I got an email from the Gates Foundation, and they were requesting proposals for ideas that were innovative approaches to addressing global challenges, including vaccine timeliness. Now, luckily, because I had gone through my business plan so many times before through all these other experiences, I put together my application in about an hour and submitted it minutes before the deadline. And so I wasn't really expecting a whole lot because this is the Gates Foundation. They receive outstanding applications from all over the world, and also most of their grant winners, the grant recipients were universities. So I was very surprised to receive a phone call from someone at the Gates Foundation, and she said, "Lauren, I was in the room when the panel of expert judges read your proposal." And she said, "They all loved your idea. Do you have an organization set up?" And I said, "Well, no, I've been working full-time. This has always been kind of a side project of mine." And she said, "Well, we can only give grants to organizations, not individuals." And so despite my best efforts in the coming weeks to try and put together a workaround solution, in the end it wasn't what they were looking for, and they recommended that I reapply in the next round. So as you can imagine, I was devastated. I had come this close to making my dream a reality and actually being able to help these people I cared so deeply about, but I had just missed that. Yet at the same time, it motivated me even more to work harder to make it happen because I had gotten such positive feedback from the Gates Foundation. So I submitted the exact same application for the following round, didn't even change a comma. And instead, in that time period, what I did was I set about establishing Alma Sana Inc. as a nonprofit organization. Now, Alma Sana in Spanish means healthy soul, and it alludes to the idea that when your mind and your body are healthy, so is the soul. I also established Alma Sana. We sent an expedited request to the IRS for 501c3 status, and normally this process takes 6 to 12 months. We received it in a record 2 months. And so a couple months later, a couple months go by, and I was a little nervous to open the email from the Gates Foundation, but luckily Alma Sana was awarded the $100,000 grant, and I knew that my life was about to change forever. The day after the grant winners were announced, I submitted my letter of resignation from my corporate job, and I knew that I was going to be taking a 60% pay cut and losing valuable benefits, but to me, this was the opportunity of a lifetime, and there was no way that I couldn't take it. So, quit my job, and I realized, okay, so the honeymoon phase ended quickly, and then I realized, okay, now I've actually got to do this. So, to calm the rising panic I was feeling, I put together a list of everything that I thought I was going to need in this project to make it happen. It was a little bit overwhelming initially because, of course, I had a proposal that I had submitted about how I was going to do it, but actually making it happen was a whole other story. So I wrote down every single thing I thought I was going to need. I grouped them into categories based on what was similar, and then I sat down and figured out, okay, what has to happen first before the next thing can happen? And in that way, I prioritized it, and the process felt a little bit like the chicken and the egg, because it was trying to figure out what had to come first before the other thing could happen. And a lot of times these deadlines were interrelated, the timelines, so I was often doing multiple things at the same time. But through this process, I realized that my two initial priorities were, one, finding manufacturer, and two, finding someone who could walk me through this research process. Because there were so many questions. Now that I had this plan, I thought, okay, well, who's going to actually make the bracelets? How do I even go about setting up a pilot project? What kind of people do I need on my team to help me make this happen? How am I going to find those people? How am I going to manage those people fairly? And what should I pay them? There were so many questions. And so the story of how I found the manufacturer is really cool. The CEO of a manufacturing company I was referred to, and during our first phone call, he offered to make, we only needed a couple hundred bracelets. He offered to make 10,000 bracelets for us because he said, I want you to focus your limited resources on other project needs. I don't want you to have to worry about this cost. So it was a really beautiful thing that happened to us, and here you can see, I was very excited. We had 10,000 bracelets, perfectly made to order. He also did 11 different product tests to make sure that they were safe for babies. In the middle there you can see the purple hole punchers, and then there's 2 Alma Sana t-shirts. And then the way that we found our key research person was just as cool. Through 5 degrees of separation, I was connected to someone who was at Johns Hopkins who was finishing up his 4th degree post-bac, and he was working with a global leader in childhood immunization. He was Alma Sana's first official team member. So the next process was, together we started working on this research process. How do you go about setting up a pilot study? Started working through all that. And in the meantime, I set about trying to hire the rest of my team. Now, studies in developing countries, basically across the board, hire locals to be their study staff. They hire people from the local communities. They train them. But as a young person who'd been given this tremendous opportunity from the Gates Foundation, I really believe strongly in the power of passionate young people, and I really wanted to be able to give that opportunity to them. So what I did was, I recruited students from the top 25 public health programs at the graduate and undergraduate levels in the country. And here you can see about half of the team. This is on the first day of the study in Cusco. And I hired a total of 19 people, 5 of whom are Cornellians, 3 of whom are here on campus this semester. So this was the team on the first day, and I have to say my team has been nothing short of outstanding, and it's really because of their dedication to this project, their belief that the bracelets will work, and their passion for helping these moms and babies that the project has been as successful as it has been. So like I said, that was the first day of the study, and the first day of the study was one of the most remarkable days of my whole life. The nurse went out to the waiting room, and she said, if you want to participate, go over talk to these girls. And this young mom here said that she would really like to participate. And so I went over to her and I knelt down and I explained to her how the bracelet worked, and she repeated it back to me so I knew she understood it. And then I handed her this tiny pink bracelet, which you can see she's putting on her baby girl here, her baby girl's wrist. And this was the first baby to wear one of our bracelets. And this was the most fulfilling, humbling, remarkable experience of my entire life because I felt I had come full circle. I had promised these moms I was going to bring these bracelets back to them, and I made good on that promise. I did exactly what I came there to do. So it was really tremendous. The project got off to an amazing start in Cusco. We're also doing a second pilot in rural Ecuador in the jungle. Got off to an amazing start, and we're nearing the end of our study now. In the coming months, we're going to be analyzing all the results, and we're going to be determining whether or not we can apply for follow-up funding from the Gates Foundation. They offer grants, additional grants of up to $1 million to be able to scale up the intervention in those countries, in addition to doing a second pilot or a third pilot somewhere else. We're all hopeful that Alma Sana is going to receive that grant, but in the end, it's not really, whether or not the bracelets actually work is beside the point. To me, the legacy that we leave is going to be determined by the actions we did and did not take, and how we responded to the global challenges that our children will inherit. If we can just take these daunting challenges, these daunting global problems, and break them down into simpler systems, and we can incorporate the feedback of the people we're trying to help, and we can conscientiously take measured risks to make those projects happen, then we really have nothing to lose. Thank you.